So, good evening, everyone. We've got more people going to join us, I'm sure. We've got 19 people on at the moment. We're very privileged tonight to have on a good friend of mine now, Mr. Rik Deitsch. Rik and I first met back in 2023 in Dallas. And the first view I got of Rik, he had on a very, very big cowboy hat. And him and his wife came into the hotel yee-hawing.
So he made me wear it because we're in Dallas. You have to wear a cowboy hat.
So we've known each other 3 years now, and was very fortunate in December that Rik came and stayed with us for a couple of days, him and his lovely wife Liz, and we got to know each other. And I've got to tell you, this man is, sorry Rik, I'm going to embarrass you now, he is one of the most intelligent men I have ever met in my life. And one of the funniest as well. So what we're gonna do tonight, first of all, I'm just gonna let you all know what we're gonna be doing. So Rik has come on to answer any questions you might have about the products. Okay, anything can go, whatever you want to talk about with the products. All right, but first of all, I'd like to welcome Mr. Rik Deitsch, who is the Chief Science Officer for Avini Health. And may I say, we wouldn't have Avini if it wasn't for Rik. So over to you, Mr. Deitsch.
Well, that's true. First of all, I always say under promise and over deliver. You never say this is the smartest guy ever. You say, here's a guy who's going to talk. All right. And yes.
So,
yeah, I don't know if you want me to do an overview or something. I will tell you this. When it comes to Avini, it is true. I am the co-founder of Avini Health with Neil Roth. Just kind of in a nutshell, I've been in the dietary supplement industry since the mid-90s. I give my background. I'm both a nutritional and a pharmaceutical biochemist. In college and graduate school, I worked primarily in drug discovery, doing something called computer adaptive drug design, using computers to kind of model molecules, see how they interacted with things in the body, how they interacted with receptors, and to model new drugs. I specialized in neuroactive peptides from venomous animals. In fact, I brought one in because everyone always asks me about cone snails. So my original research was cone snails. So this is a cone snail. This is actually Conus Regis, the crown cone. See how the top kind of looks like a crown, like a royal crown? So this is Conus Regis. I caught this guy right up, about 10 miles away off the beach. But the cone snails sit on the bottom of the ocean. They kind of crawl around. They stick out their tongue, and their tongue kind of looks like a worm. And when a fish comes to eat the worm, it stabs the fish, injects a paralytic venom, pulls it in, and eats it. And so we studied the venom from cone snails, and I studied something called alpha toxin, which was a potent agonist of the acetylcholine receptor. And I actually looked at it for a potential pain drug. And that research led to my first drug, the first drug I ever worked on, which was called ziconotide. We called it SNX111. It eventually got approved as the drug Prialt, Prialt, from the Irish company Elan Pharmaceuticals. That was the first drug I ever worked on, and it came from cone snail venom. I started looking at other things because it's really, really hard to milk a snail, and you get very little venom from a snail. So I started looking at cobras, and you can see this is our cobra. Our mascot Corky, the cobra. So I started looking at cobra venom in the early 2000s and started working just on venom from cobras. And we've developed my public company, biotech company, Nutrapharma. We have 21 patents using cobra venom for all sorts of things. But for your purposes, we use cobra venom for the treatment of pain. And we sell it as Avini Plus Relief. So here's the Plus Relief. Is an extract of cobra venom that is a potent modulator of the acetylcholine receptor. So I started working in drug discovery with cobra venom, but I met the love of my life. Adrian mentioned my wife Liz, and I needed to make money because she has very expensive tastes, and I had to get a job. I couldn't just be a basement chemist making to try and discover new drugs. And so I got a job with a company called Rexall Sundown. Rexall at the time was the largest manufacturer of dietary supplements in the United States. And I had a meteoric rise at Rexall. I started as just a chemist. I became head of product development within less than a year and a half. And I started developing dietary supplements with Rexall Sundown and their division. They had a network marketing division called Rexall Showcase. We were a $220 million division, and I made all the products. So that was kind of my introduction to network marketing and dietary supplements. And with Rexall, I did over 50 different clinical studies with dietary supplements, made over 50 different products. And that kind of rolled into my work in network marketing, where I got to not only make the products, I got to talk to people like you, explain how they worked, see the end user, something most chemists don't get to do, see the end user of the product and hear your stories. I mean, if you've ever heard some of the stories, my partner Neil Roth calls it our emotional compensation. We get to hear how our products are actually affecting people. Um, and so the problem with that is over the years, I've been working with Neil Roth in several different companies, and one by one by one, they all seem to go out of business. And it has nothing to do with us. In every single case, it was either greedy owners or poor management. And so I brought my products to several companies over the years. Finally, in end of 2021, mid 2021, the company that had my zeolite technology, the owner of that company got arrested on 7 counts of wire fraud and embezzlement, and he went to jail. He's in jail right now, and that company failed. Nothing to do with me or my products. It was just bad owners. So Neil said, if we start our own company, we're the owners and the managers. We're the only ones that can screw it up. And so that's where we actually founded Avini Health. I did not want to make Avini Health. I apologize for that to all of you who are fans of Avini, because I knew it was going to be a lot of work. At the time, I was writing another book. I was working on my research, my drug research. For now, NutraPharma, I mentioned before, we have 21 patents for the use of cobra venom in a variety of different indications. We have a patent for its use in multiple sclerosis. We've had over 300 MS patients on our drug, which is an extract of alpha cobra toxin that we modify. It is an injectable drug. We did a study in England under MHRA for AMN, adrenal mononephropathy, with that drug, which is a lipodystrophy. We did it at King's College in England. So we're now working on 2 phase 2 trials in MS in the United States. So that's what my focus was. But Neil was really wise. He didn't have to convince me. He called my wife and convinced my wife to start this company. And so in May of 22, we started Avini, and we didn't look back. And it's grown huge. We started 6,000 square feet down in Plantation, Florida, which is about a half hour south of where I am now. We moved into 18,500 square feet in Boca Raton. We just leased next door another 15,000 square feet. We currently have 33,000 square feet of space. We're adding 2 more production lines, but we have 2 capsule filling lines, 2 liquid filling lines, a canning line, tube filling line, 3 form field seal machines to make packets, 3 capsule filling lines, and a full capsule filling bottle line. And we're adding soft gels and gummies now to the line. So we make pretty much everything except tablets in this facility. We're fully vertically integrated. We make everything in-house. We do our own testing. We have our own laboratories. I don't know if anyone has the ability to come out here. We are doing next month, actually May 15th and 16th. We're doing a meeting in Boca Raton. That Friday, we're giving tours of the facility, and then all day Saturday is a training. If anyone has the wherewithal to get to South Florida, it's certainly worth it. Hang out with us for a couple of days and see what we do and where we do it. So that's Avini Health. We now have a lot of products that have done a lot of good for a lot of people. I'm sure you already tried some of the products and have had benefit. With that, Adrian, is there anything you want me to dive into?
Yeah, if you could talk about our tip of the spear, celldefender, and how that came about, Rik? I'd like to know a little bit about the history of celldefender, how you came across it.
Yeah, so celldefender is a zeolite. If you guys don't know that, zeolites are natural minerals. They're formed of volcanic from volcanic ash. I have can you see my background? Let's see if I can do this. How do you do the backgrounds, virtual backgrounds? Here we go. Okay, so that's actually a zeolite cage behind me. That's clinoptilolite. It's a repeating crystal structure. Let's see if I can get it right. Of 10-sided and 8-sided pores. So 8-sided and 10-sided, repeating 10-sided, 8-sided, 10-sided, 8-sided. It has a diameter of 4.2 by 4.2 angstroms and 4.2 by 7.5 angstroms. That's the pore size of the zeolite. So zeolites are kind of cool because they're natural products that have a cage-like structure. They're also negatively charged, one of the few negatively charged minerals found in nature. Because of its negative charge and its cage-like structure, it has the ability to draw to itself and trap within itself a variety of different compounds. The first zeolites were actually discovered as a chemical compound in the mid 1700s when a Greek researcher was heating up rock, powdered rock, and it boiled. Water came out. So zeolite literally means boiling rock or boiling stone. The zeolite has so much space in it that it can actually hold on to things like water. It holds water inside the zeolite cage. Now, there's different types of zeolites. There's 49 different types of zeolites. We use a zeolite called clinoptilolite, which is this structure behind me. Clinoptilolite is really cool because of the pore sizes and the aggregate negative charge around the pores. It loves small, highly charged things. It doesn't like bigger things. And this is just nature. All the things that tend to be bad for us are small and highly charged. So it loves mercury and lead and cadmium and arsenic and tin and bismuth, aluminum, antimony. It does not like magnesium, calcium, phosphorus, sodium, potassium, all the good metals. It also likes volatile organic compounds, which have a flat structure that can lay across the surface of zeolite and get trapped. So this particular zeolite, clinoptilolite, has been used for over 800 years in traditional medicine. In fact, in India, there's whole societies called geophasics or clay eaters that eat this stuff every day as part of their diet and have done so for almost 1,000 years. Um, Nature even knows how to use this. There are parrots in West Africa that eat a toxic fruit, a berry that grows on this tree. And for years, researchers were trying to find out why the parrot didn't die when it ate these poison berries. They were studying, and then finally someone decided to follow the parrots. And what happens, the parrots would eat the berries, and then they'd fly about 10 miles away to a cliffside where they would poke at the rock and eat zeolite, clinoptilolite zeolite from the cliffside, and it actually blocked the action of the poison in their bodies. Isn't that cool? Nature finds a way. So they could eat this toxic fruit and not die because they knew about zeolites. They knew about it before we did, you know? So zeolites have been used really around the world, not only part of diets like in geophasics in India, but it's been used in water filtration, air purification. It's been used in animal feed in the United States for the last 100 years. It's been used in kitty litter. It's used in the production of cement. It's used in a lot of different things to try to purify and remove toxins and impurities from solution. In animal feed, it was specifically used to prevent aflatoxicosis from fungal and fungal that got into animal feed. So Aspergillus parasiticus and Aspergillus flavus that could be in nuts and beans and wind up in animal feed could cause liver failure in animals. They added the zeolite and it reduced that risk, actually eliminated the risk of aflatoxicosis. So this is something that's been very well studied, very well established. I looked at it in the mid to late 90s as a potential dietary supplement because there was a company that was already selling something in England. The company was called Uremica, and they were selling a product called Megamins, and it was just zeolite with vitamin C in a capsule. And they talked about the fact that it could remove toxins and things like that. And they asked for my help in kind of validating their product and making it better. So when I looked at it, I realized that they had some issues with their product. The first thing is that the zeolite they were using was too big. Their average particle size was about 20 to 200 microns, which is like a rough granular sand. And certainly that can go in the gut and remove toxins from the gut, but it's not small enough to be absorbed from the gut into the bloodstream to become a systemic detoxifier. So my recommendation was to micronize it to reduce its particle size. So they actually do a micronization process. They call it tribomechanical activation. They use these spinning metal plates and kind of grind it up, but it's not standardized. They have no idea what kind of particle sizes they're getting. And even now, with their process, their average particle size is about 10 microns, which is too big to be absorbed. The other problem with zeolites found in nature is they're dirty. They're really dirty. I mean, we have a zeolite mine site in New Mexico. It's an open pit mine. When air flows through it and water flows over it, when it rains, the zeolite is sucking up toxins from the environment because that's what zeolites do. They're nature's filters. They just pull in everything they have a high affinity for. So when you get the zeolite from nature, from a mine site, it's full of volatile organic compounds, benzene, dichlorobenzene, phthalates, furans. It's full of heavy metals, mercury and lead and cadmium and arsenic. But the zeolites, it sounds counterintuitive, but the zeolites are considered to be safe because it has such a high affinity for those toxins. When you ingest it, it's not going to release those toxins into your body. It's just going to hold on to them. But if the zeolite is so dirty and already full of high affinity toxins, how much space does it have to detoxify you? And so that was my contention. I said, is there a way to clean out the zeolite cage to give it more surface area and therefore activate it? And I call my process activation. So my processes are micronization and activation. I reduce the particle size to less than 1 micron. My average particle size go down to about 347 nanometers, and I clean out the zeolite so it has all of those high affinity particles gone. So it has the most surface area to be able to clean out your body when you take it. Um, my favorite example is the kitchen sponge. If you've got a dirty kitchen sponge, are you going to be able to clean your pots and pans, be able to clean your counter with it? No. You take it to the sink, you use hot water and soap, and you clean out and you just wring it out. Eventually, you have a clean sponge that now is more active. It can hold more things. It can clean your kitchen, and that's kind of what I'm doing with the zeolite. Of course, that's an oversimplification of what I actually do. So those are the processes I came up with in the late 90s, early 2000s. I actually pitched those to the company that, believe it or not, hired me to do this and help them with their product. And they were not interested in my processes. They didn't want to do what I recommended. So I decided to do it for myself. And I started doing the work in the United States. They actually have continued to make that product. You can look it up, Megamins. You can even look up Uremico. It's EURIM, Uremico, ICO, I think. But if you look up twice, they've applied to get it approved in England, and twice they've been denied for the same reasons. Because when they tested the product, it was full of mercury and lead and cadmium and arsenic. And they said, we can't sell this product. It's full of all these things. So they've not been able to get their product even approved in the UK because they didn't do my process. They didn't do my micronization activation. So I launched my first zeolite with a company called Wayora. We called it Natural Cellular Defense. And it was so popular, it did so well that we sold over 5 million bottles of that through that company. And so that company was I made the product from about 2005 through about 2012. And then I licensed the technology. Unbeknownst to me, they didn't use my process. They started using other processes and sales went down. Eventually, they closed that company. But in 2018, I did sue them in federal court in the United States to get my rights back. And so they were continuing to sell it. They weren't even using my process. I sued them under a law called the 2016 Defensive Trade Secret Act. And I won in court, in federal court. I defended my process as my trade secret and got all the rights back. And so after 2018, I sold to other companies. Eventually, as I said before, we went to a company called Devon Global. That got shut down. Then it went to Amplify. That got sold to another company. And then I finally said, forget it. And we brought it in-house to my own company, Avini Health. Since then, we have done, over the years, 15 clinical studies. We've done studies in healthy individuals. We did 3 studies and published it as a single, 3 trials and published it as a single study in the Journal of Clinical Nutrition. That's a peer-reviewed journal that's available on the website. But that showed a 7-fold increase in heavy metal excretion in healthy individuals. otherwise completely healthy individuals. My favorite study we did in West Virginia coal miners. This was a 3-month trial. I said, where can I find the most toxic guys around? Well, you're mining coal. You're breathing in this coal dust all the time. So we did a double-blind, placebo-controlled study over 3 months in West Virginia coal miners, and in those individuals, we saw a 15-fold increase in heavy metal excretion. When we asked them how they felt, we did something called a pencil paper test. All of them who used the product said they had more energy during the day, they were sleeping better at night, they had improved cognitive function. Almost everyone said it was like a fog lifted off their brain, and they had improved visual acuity. Their eyesight improved, which I found odd. I couldn't figure out at first why they had improved eyesight. Well, since then, we realized that we're improving liver function by detoxing the body. Liver enzymes improve and glutathione production improves. And because the liver makes glutathione, and glutathione is a principal antioxidant in the eye, you wind up with actually better visual acuity, especially night vision and glare recovery. So that's just a side effect of a cleaner, healthier body. So the other thing I love about the coal miner study is that we told the patients to take the product any way they wanted to take it. But we wanted them to be consistent in the way they take it and tell us how they took it. And most of the patients, just, shake it up and would just, put it in their mouth, like most of you do. Some of them added to their food or drink. There was one guy, meat and potatoes guy, added to his mashed potatoes every night for dinner. There was one guy, every night before bed, had a glass of scotch. He added it to his glass of scotch every night before he went to bed. And it didn't matter how they took it. Get it in your body. Everybody got the same benefit. So when people say, can I add it to food or drink? Absolutely. Add to your food, add to your drink. Can you take it directly? Can you cook with it? It doesn't matter. The stuff is indestructible. You can add it to anything. You can cook with it. As long as you get it in your body, you're going to get the benefits. How was that, Adrian?
That was marvelous. Wonderful.
Yeah.
Thank you very much.
Let's see if this works. I like to see the wonder of Zoom. I say, oh my God, the zeolite. It's drawing me in.
I love it. That worked, Rick. That's very, very good. No, you're extremely funny as well as intelligent. Wonderful. Right. If anyone has a question for Rick, could you unmute yourself and ask away? Come on, don't be shy.
Hi, Rick.
Lorraine, fire away.
Yeah, hi. This is I've got a question from one of my downline. Actually, she's had someone who's and I don't know if zeolite will be able to help it, the celldefender. But a friend of hers has some sort of mold in the body. Will it help with mold in the body? I don't know much about it, but will it affect mold? Is it still worth taking for her?
Not directly. The zeolite does alkalize the body. It does create an alkaline environment, which is an inhospitable environment for the growth of molds and yeast. And so people who have had like systemic candida infection have done very well with the zeolite. But I'd actually recommend the nano silver. Do I have a bottle here?
Okay.
I have a bottle of the nano silver.
Yeah,
the nano silver, the nano silver is highly antibacterial, antiviral, anti-protect, anti-mold, anti-yeast. I like to say it's a really good 1-2 punch where the zeolite takes out all the non-living things that don't belong in the body.
Yeah.
The nano silver takes out all the living things that don't belong in the body. So
Okay.
I'd highly recommend using the nano silver. That's going to help a lot.
Okay, I'll let her know.
Okay.
Thank you. She's got a young baby who's not well, so she couldn't make it tonight.
Okay, yeah, get her. See, she should be in the celldefender and the nano silver.
Okay.
Okay.
Thank you.
Stephen, you had a question.
Yeah, please. Thank you very much. Hello, Rick, and pleasure to meet you, sir. Right. Yeah, a couple of hopeful clients. One has got, she's going to be having a thyroid removed, which then means she's then got to be on basically high calcium tablets and all the rest of it for the rest of her life. And she's basically asking the question, would this help? So that maybe she didn't have to have the thyroid removed.
Yeah, well, let's take a step back. She hasn't had her thyroid removed yet, right?
No.
Okay. Find out why she's having her thyroid removed. I mean, if she has thyroid cancer, that's one thing.
No, it's not thyroid cancer. She has an overactive thyroid.
Hyperactive thyroid. Okay, so
Yeah.
find out in that case if she has a diagnosis of a disease, either Hashimoto's thyroiditis or Graves' disease, in which case that's autoimmune, in which case we could probably do something about that and save the thyroid.
Right.
The
Yeah.
cell defender helps a lot. The cell defender is fantastic as an immunomodulator because a cleaner, healthier body does fix itself. But we have a product called Zimmunity. Zimmunity is a natural immunomodulator. It's a blend of 7 different mushrooms with my zeolite in it and with an saffron extract that acts as a mood elevator. But there's tons of research on the Immune Assist Supreme, which is a blend of 7 different mushrooms on balancing and modulating autoimmunity. So it prevents the hyperimmune reaction. I'd look at that. The other thing you have to look at with thyroid, you really touched on a touchy subject for me. Thyroid is a soapbox issue for me. I hate it when a woman goes into a doctor. It's usually a woman, usually a little overweight, and the doctor says, "Oh, you have a sluggish thyroid." There's no such thing as a sluggish thyroid. It's a ridiculous statement to make. What happens is usually because of nutrient deficiencies, the thyroid doesn't function the way it's supposed to. So I know you guys didn't ask for a thyroid lecture, but strap in. You're about to get a thyroid lecture. Okay. So thyroid is a great little gland. It's right around here. The thyroid actually tells your body how to function metabolically. It tells the body what to do with all metabolic function. The first thing that happens is your adrenal glands produce something called TSH, thyroid stimulating hormone. The TSH goes to the thyroid and tells the thyroid to make something called T4. T4. It's called T4 because the molecule has 4 iodine atoms attached to it. So, first lesson, what do you need to make T4?
Iodine.
You need iodine, whatever you guys call it. Okay, you need iodine. So back in the 1930s, 1940s, a lot of people used to get goiters. That was a swollen thyroid from iodine deficiency. So we started iodizing salt. We started adding iodine to table salt. And that really made goiters go away. People had salt in their food and they didn't have goiters. Well, right about the late 80s, early 90s, everybody started going on low salt diets for their blood pressure. Next thing you know, everyone's got iodine deficiencies and everyone's got goiters again, and they have thyroid issues. So if she was on a low salt diet, that's the first question. She could probably simply have an iodine deficiency. The blood work tells it all. If I see a high or high normal TSH and a low T4, that is always an iodine deficiency. You can get iodine from pretty much. You get iodine from seafood. You can get it if you just eat a regular salt diet. You can get it from kelp or bladderwrack. Lots of iodine supplements. The next thing is iodine is not active. Is not an active hormone. I'm sorry, T4 is not an active hormone. T4 goes into the liver and gets converted to something called T3 when iodine is removed. That is the active thyroid hormone. That is what controls metabolism in the body. The enzyme that converts T4 to T3 needs a cofactor of a metal called selenium. So if I see high TSH and high T4 and low T3, it's always a selenium deficiency. Selenium is a micronutrient. You need about 200 micrograms a day, but it's necessary for life. If you're not getting that 200 micrograms a day, you could die. In fact, in the mid-1980s in China, about 20,000 people died of something called Guillain-Barré syndrome. It looks like hypothyroidism, but it's a selenium deficiency. A tablespoon of selenium fed the whole country. They just need micrograms of selenium, but their bodies couldn't function without it. And that's because of their farming practices in China. They had actually mined out all the selenium in the soil because of poor farming practices. So that was solved. They figured out what that was, and that was issued. So you can see something called Guillain-Barré syndrome is clinical selenium deficiency. So looking at the blood work is the easiest thing. You see normal TSH, low T4, low T3, that's a iodine deficiency. Normal TSH or high TSH, normal or high T4, and low T3 is a selenium deficiency. It's pretty easy to look at. And a lot of people, doctors will say, well, all your thyroid numbers are normal. But look at the T4. The T4 will be on the high side of normal, and the T3 on the low side of normal. That difference is still enough to cause hypothyroidism, that deficiency. And so just make sure they're getting their selenium and they're getting their iodine. Okay, so that is your thyroid lecture for the day. But if they have a hyperthyroid where they're making like way too much TSH, that's an
she's lost a
adrenal
lot of
problem.
weight. Yeah.
Well, that's an adrenal problem. That's usually caused by an hyperactive or overactive adrenal gland, and it's usually caused by the immune system. It's autoimmune. In which case, if you look at the blood work, she will have an elevated ANA, which is an anti-nuclear rate, and an elevated CRP, C-reactive protein, which is a measure of inflammation. So a lot of this stuff you can see right on the blood work. All right. But if she hasn't had her thyroid out yet, I would highly recommend using the celldefender and his immunity and start looking at those numbers, especially the ANA. She might also want to look at the SED rate, sedimentary rate, which is rheumatoid factor. That should reduce as well over time, and she might be able to save the thyroid.
Right.
Okay. But let's look at that blood work and see. Now, if she does have her thyroid out and she's not making those compounds anymore, she will need to be on something called Synthroid, L-thyroxine, for the rest of her life, which actually helps monitor metabolism. So if you're already missing your thyroid, you need to be on the medications.
Yeah.
Okay.
The other was another lady who's got her parathyroid. She's been having parathyroid problems since she was 14. Yeah. And again, would the celldefender be of some help for her?
It depends what the problem is. There are genetic parathyroid issues that can lead to the Cushing syndrome. There's syndromes that come from. What's that?
Are you around next Friday?
It's whoever's
someone's
talking about. Hold on a second. Sorry, I'll try to find out who that is. Carry on, Rick.
Now, if anyone's not actively talking, just mute yourselves.
If you can mute yourself if you're not talking, please.
I thought it's someone that was jumping in and helping me out. So there's lots of parathyroid issues. Most of them are genetic. Some of them are caused by environmental toxicity, and some are caused by disease or viruses. So I try to find out exactly what her parathyroid issue is. But certainly, it sounds terrible. It sounds like a panacea. The celldefender helps everything because all of us are toxic, and toxins inhibit metabolic function. If you get rid of these heavy metals, you get rid of these volatile organic compounds, everything works better. And you'll see me in my lectures. I say a cleaner, healthier body fixes itself because that is a fact. When you get these things out of your body, everything starts to function better. All right.
Right. The other was
all right, 1 second.
Sorry. The other was a friend who's got heart condition and he's on medication. Will the celldefender, will anything prohibit his medications?
You know what the heart condition is? What his heart condition is?
I shared the actual medications he's on at the moment. He has, when you have pains in your chest, it's
Angina.
Sorry?
Angina.
That's it. Angina.
Okay, so pain in the chest, that's kind of a blanket thing. Believe it or not, the Plus Relief is clinically proven to treat angina pectoralis, which is pain in the heart. So that's from overstimulation, neural stimulation of the heart, which can cause spasming. So I highly recommend, of course, the celldefender. And then we have a product called Plus Cardio Care. Cardio Care.
Yeah.
Okay. The Plus Cardio Care, I'm very proud of this product. I put together about 30 years of research that we've done on other heart products into this one product. It deals with the entire cardiovascular system. It helps feed the heart as a muscle with CoQ10, L-taurine, and hawthorn. It also helps with heart rate and rhythm with the hawthorn. It's got ascorbyl palmitate, which is a fat-soluble vitamin C, which is clinically proven to reduce atherosclerosis and arteriosclerosis, making the large blood vessels more supple, more flexible, and reducing plaque in the large vessels. And then it's got things for surface circulation. It's got L-arginine and citrulline, which help make nitric oxide, which relaxes the blood vessels and helps with blood flow and circulation. And it's got brevicapine in it, which is an extract from flowers in China that greatly improves surface circulation. That's not only good for the entire cardiovascular system and circulation, it's even good for the sex organs because they exist as well. So that's even used in Adrian's.
Sorry.
So it's even good for sexual function. So the entire cardiovascular system and even sexual function. So he should be in the celldefender and he should be in the Plus Cardio Care.
Right.
Good.
Okay. And then the last question.
Yeah, and then also I mentioned the plus relief for angina pain. Okay.
Right. Okay. And then the last question is plastic packaging. Yeah. One client to be, she's basically stated, well, hold on. If we're trying to take plastic toxins out of our body, why is the product made in plastic packaging?
Well, they're not made in, they're stored in. So we don't
Yeah.
make anything in plastic, but we use only anti-leaching, BPA-free plastic. Okay. So as long as you store it less than 120 degrees Fahrenheit, then it's not going to leach at all. Okay. So we use very good plastic in all of our packaging, even the celldefender. Now the celldefender you can get in glass. We do have
Yep.
it available in glass with a glass dropper if people really don't want any plastic. We use a BPA-free anti-leaching plastic, stored in a cool, dry environment. As long as you keep it under 120 degrees Fahrenheit, you're not going to have any leaching. Okay.
Okay.
But it is a good question.
And it's recyclable, of course.
Yes, it's all recyclable. Yes. All right. Steven's had enough time.
Linda, Linda, Linda.
It's on your Trim Science capsules, Rick. So is that okay to ask about that?
Absolutely. I got some right here.
Ah, good. Well, I just took mine, and again, I forgot to take it before I ate. So my question is then, I know the benefits of everything it does, but I assume because the bottle says 1 hour before you eat, you don't get the same benefits if you take it afterwards, or am I incorrect?
You got to just think about the benefits. So it's got the caffeine in it, which is thermogenic. It raises your core body temperature and helps you burn fat. So that's going to happen no matter what. But some of the biggest benefits of berberine are the satiety, the raising the leptin and ghrelin, which turns off that food noise. So the best time to take it is within an hour of meals, between like 15 minutes to an hour before you eat. That's going to help you control your appetite and turn down the food noise. But that'll happen anytime you take it. So if you're an afternoon snacker, it's still going to help. If you're an evening snacker, it's still going to help. I actually helped co-write a book called To Binge or Not to Binge with Dr. Kenneth Blum, where he talked about reward deficiency syndrome and how the brain craved carbohydrates. And the side effect of that research, believe it or not, was that the craving was the same no matter what it was, whether it was carbohydrates or whether it was drugs, whether it was sex addiction or gambling addiction or alcoholism. Those pathways are exactly the same in the brain. It's the brain seeking a reward. Some people's reward is food. Some people's reward is sex. Some people's reward is gambling. Some people's reward is drugs or alcohol. It all works the same. So if you can actually control that pathway, that reward deficiency pathway, and turn down that noise, it helps in all of these cravings, which is kind of cool stuff.
So it still does all the other benefits. I just won't get the same benefits to not crave eating.
Yeah, well, there's other things like specifically the big one is going to be the phazolamine, which is the white kidney bean extract. That blocks an enzyme called alpha amylase and prevents you from breaking down carbs. And so some of the carbs in your diet won't be broken down and absorbed. And if you're eating too many carbs, that leads to higher sugar in the body and higher fat storage. So that really is only beneficial when you take it before a meal. Otherwise, you're kind of wasting it.
Yeah. Okay.
Okay.
But better to take it if I forgot than skip the day.
Yeah. You're better off just taking if you just ate lunch, you're still going to get benefit taking.
Okay.
Okay.
Thank you very much.
All right.
Brian.
Hello, Rick.
Hey.
Hi. Vegas seems a long time ago already. I've got a friend of mine who's asked a question. He's had quite a serious nerve vasculitis situation for the past 2 years, which he's kind of recovering from now. But he's taking a lot of medication, and he's going to be on this medication, about 15 tablets a day. He's worried that I've told him about celldefender and everything, whether there's any risk to him taking our products with the medication that he's on.
Okay, so the celldefender is not contraindicated with any medication at all.
Yeah,
perfectly safe to take with medication. It's a very passive product. I want to take a step back though, because you said a neural vasculitis. So vasculitis is blood vessels. It's not the
Right.
nerves.
Yeah.
So I don't know if it's nerves or blood vessel. It would be nice to know exactly what he
Well,
has. I give better advice.
what he's been left with is he's got no feeling now in his toes or front part of his feet, because when he went skiing recently, he had a problem because he was not, he can't feel anything there. And he's
Yeah.
been told
All right.
that those nerves are now gone. But
Okay, so that's called neuropathy.
Right.
The number one cause of neuropathy is diabetes. So
Right.
so it could be diabetic. Other causes are genetic. There's stress. There's trauma. So the first thing I'd ask is he diabetic?
Right.
Okay. Do you know if he's diabetic?
I don't believe he is. He's not mentioned that. No.
Okay, because there's specific information I would give for diabetics.
Right.
I will tell you that the plus relief is clinically proven to help in neuropathies.
Right.
Okay, so the primary use of the plus relief is for pain and inflammation. But the way it works is it modulates signals through the nerve. It binds the acetylcholine receptor, which is the pathway by which the nerve signals travel. The funny thing is, pain is a big signal, so it dials down that signal. But smaller signals, the signals are too small, get dialed up. So it actually does improve things like neuropathy and improves that nerve signaling. As an example, one of my earliest investors called me crying after I sent him some product. He was in his 60s and he had arthritis, so he was taking the product for his arthritis. But he calls me crying because he said when he was 9 years old, he got hit in the face with a baseball and it broke his orbital, crushed his cheek, and he has not felt his right cheek since he was 9 years old. So even though he was taking the product for pain, he got feeling back in his cheek for the first time since he was 9 years old. So that's telling me that it's improving neural function, improving signals to the nerve. So it turns down the pain signals, but it's turning up other signals. So it will help with neural inflammation, neural damage over time. Now, the periphery is tricky. It depends on how long that damage has been done. The peripheral nerves are different than the nerves in the central nervous system. They hate each other. And when you have a nerve die in the periphery, it actually does something called Wagnerian degeneration. It tries to kill the nerve upstream and downstream from it. No one knows why. It makes no sense whatsoever, but it does that. And so depending on how long he's had that damage tells you how long it will take to fix the damage.
Right. Okay.
Now, the good news is all your nerves have a myelin sheath, a fatty sheath that wraps around it that creates the insulation in that nerve. In the central nervous system, that's created by something called an oligodendrocyte. And when the nerve dies in the central nervous system, the oligodendrocyte also dies. So the myelin sheath goes away. In the peripheral nerves, the myelin sheath is created by something called a Schwann cell. And when the nerve dies, the Schwann cell does not. It stays there. So you have a tunnel through which the nerve can regrow. So it's actually easier to repair those peripheral nerves than the nerves in the central nervous system. So it gives you more hope in things like neuropathies.
Fantastic.
Okay, I know my answers are probably way longer than you guys
that's
want.
fine. But that's really useful. I'll go back to him and give him some assurance. That's great.
Yeah.
Excellent. Thank you.
I can't help myself. My wife once said, "Can't you answer yes or no to any question?" I said, "No, I can't. Let me tell you why."
Ranjit, you're up. Ranjit.
Hi. Hello.
Hey there.
Hi. Yeah, going back to Brian's question as well. Is that apply for plus relief when you use a spray, or is that the gel as well?
For which question? For the
Brian's question about
the neuropathy?
Yes.
Yeah, neuropathy.
Yes, I would recommend both, because here's the tricky part. Sometimes you feel pain in your legs, your arms, and that's not where the problem is. The problem is sometimes upstream. So an example is sciatic pain. So people feel pain in their legs, but it's actually impingement of the sciatic nerve in the lower back. So I can't tell you how many times people take the gel and they're rubbing it all over their legs and telling me I'm not helping them. It's not helping them, but that's not where the impingement is. The impingement is the sciatic nerve in the lower back. So you need to rub the gel in the lower back. So I usually recommend when people have downstream pain, they use both the oral spray and the topical gel. So the oral spray is systemic. It's going to help with pain and inflammation everywhere. But if it's in the feet, rub the gel in the feet. That's going to help too.
Yeah, thank you.
Okay.
Yes, and then following on from that, the other question I had was, so on the bottle it says use within 3 months. Is it still potent if you haven't finished using it?
Yeah. Now, once you open it up, there is some protein degradation, but it's a technically denatured peptide. It's going to be good forever. So, I mean, I have product literally years old that have been sitting around. They're still perfectly fine. So, yeah, you can. They put it there. They just want you to use it quickly and then buy more product. So,
Thank you.
Linda, did you want to ask that question?
Okay, yes. Your statement, Rik, that you made, if it was diabetic neuropathy, you give a different answer, different suggestion. I do have to leave early, but if you can answer that, I can always watch the recording to catch your answer.
Listen, I talked about the nerves and what you do for the nerves and for circulation. Obviously, we have the Plus Cardio Care for circulation, but if they're diabetic, I'd highly recommend the Plus Fiber, especially the new Plus Fiber Plus Probiotic. The Plus Fiber is clinically proven to reduce postprandial hyperglycemia and reduce HbA1c and fasting blood sugar. So if you take the fiber before meals, it delays gastric emptying, your food gets absorbed more slowly over a longer period of time and helps control your blood sugar levels. So we did a study with the Cleveland Clinic, published study, and it clearly shows fasting blood sugar goes down, HbA1c, which is a measure of the 3 months of your blood sugar, goes down. So it's really great for diabetics. So if I was dealing with someone with diabetes, on top of everything else I recommended, I also recommend the Plus Fiber before meals.
Okay. Thank you very much.
Okay.
Has anyone else got any questions?
Yes, I'd like to ask one, please.
Go, Anita.
Can you hear me?
Yeah.
Anita.
Yeah, that's Anita.
Hi. Hi there, Rik. Pleased to meet you for the first time. Yeah, I've got a couple of questions. One is that my elderly mother gets a lot of pain around her hip and back area. She's 88 actually. But I wondered, is there a restriction on what medication somebody takes? I know you spoke about medication earlier, but she has an Oromorph patch. So I've kind of been a little bit reluctant to actually even speak to her about the products at the moment. So is there any product that what would you advise that if you were going to recommend to somebody that's on sort of fairly heavy pain medication?
Yeah, well, there are no contraindications with our products with pain medication. In fact, the Plus Relief is synergistic with other pain meds because the mechanism of action is wildly different than every other pain med. So I tell people if you take the Plus Relief and even take a Tylenol or an aspirin, you get dramatically better results because it's synergistic with all those other products. So she should certainly use the Plus Relief. When it's hip pain, it's usually loss of cartilage, bursa, or meniscus. So I'd greatly recommend the Plus Motion. Do I have a Plus Motion? I don't have a Plus Motion to show you. The Plus Motion is really a game changer when it comes to this stuff. It not only prevents your body from breaking down cartilage, it helps you build new cartilage. It helps you create synovial fluid, which is the lubrication. Yeah, Adrian has a bottle of Plus Motion. And for the first time ever, it's got an ingredient called tendaxion, which is clinically proven to rebuild the tendons, to line them up and rebuild the tendons, which is amazing. I tell people myself, I fell off a motorcycle 15 years ago. It sounds cooler than it was. I was an idiot, and I got a motorcycle on a driveway, and it just went right out from under me. But I kind of crushed my left shoulder, and I wasn't really a surgical candidate, but for 15 years, I have not had range of motion in the shoulder, and I'm doing things now I haven't been able to do in 15 years. I mean, my wife saw me once. I was in, my wife just walked in. Say hi. Adrian already introduced you as my lovely wife.
Hello, Liz.
This is Liz, my wife.
Hi.
So we said how smart you are already. So, but I remember we were on a beach. Was it Venice Beach with the?
Yes.
Yeah, I was on the rings of Venice Beach, and I tried to swing on my left arm, and the pain was excruciating. I was crying for days because of the pain, and I've not had any issues since I started the Plus Motion. So it is really a game changer when it comes to for any kind of joint discomfort, especially loss of bursa, meniscus, or cartilage. So I'd highly recommend that for your mother's hip. So if she can take the Plus Motion, but she should use the Plus Relief. She can use it topically on the area and take the oral spray as well.
Thank you.
Yeah, I'll say one more thing. not only are we not contraindicated with pain relievers, but I've made a mission on getting people off of opiate drugs.
Yeah.
I've been working with disabled American veterans. I work with Mike Fuller, Colonel Mike Fuller, and Lieutenant Colonel Tony Colmenares. These are known people in the field. I've been donating the product now since we launched it in 2013. The original product, Niloxin, and the Plus Relief. And to date, we've gotten over 1,000 veterans off of opiates. So I'm very proud of that. You know, people that could not exist without being on an opiate drug now have gotten completely off their opiates, and this is all they use, which is non-narcotic, non-interactive, non-habit forming, doesn't cause cognitive decline. Their lives are completely different since they got off the opiates.
So would that actually be good for me as well? Because I broke my pelvis a couple of years ago. I saw a consultant last week actually, because I thought it was, I've got a couple of disc problems, so I thought it was that playing up. But he said to me that it was from my pelvis. Now I'm healed and I'm fairly active because I dance and stuff like that, but I have constant pain. And almost a leg weakness as well in my glutes. So I wondered if that would help me.
Yeah, so if I saw your scans, I'd probably see either some bone spur formation from the trauma or even a little bit of impingement into the spine. This will certainly help for pain and inflammation. I would keep in mind later do an MRI and see if the impingement is too much. You can do an outpatient procedure called a partial laminectomy, which will open up that root in the spine, and that should remove the impingement and actually help with the glute weakness. All right, so for now, definitely use the Plus Relief. You can use the oral spray and the topical gel. But in the future, I know it's going to help. But in the future, if you still have this pain, take a look at it and maybe look into doing a partial laminectomy.
Okay, thank you very much. Okay. Appreciate you.
Brian,
my pleasure.
Brian.
Just a quick one, Rick. I thought you'd like to know. A very good friend of mine who I've known for 50 years, recently introduced to the products, and he was a little bit negative at first, as Adrian knows because we met up with him. He has had the most phenomenal outcome since he's been using the products. He's had knee pain. He's in the bathroom business, so it sort of goes with the territory. But he started using the products, and he called me one morning, a few days after, and said for the first time for many, many years, he's able to walk up and down the stairs without any knee pain. He's absolutely thrilled.
I love that he's in the bathroom business, and that asks so many questions. I'm like, I don't want to
know. he's actually sitting in this call now.
Because he said he wasn't going to be able to get on.
Yeah, Paul is there smiling at the moment. Do you want to say anything, Paul?
Can you hear me?
Yeah, we can hear you.
Yes.
Yeah. Well, yeah, to say I was a bit dubious about all this was an understatement, really.
To say the least. Because
I've known Brian for many years, and he always gets on these sort of earn a buck quick schemes. And it's gone from magnets, it's gone from this and that. And he said to me about this new stuff. I said, yeah, right, okay. Well, to be honest with you, he hounded me so much. I spent and bought the $499 set just to shut him up. And I started with the little the
celldefender.
Useless. I've had one hell of a day, but it's the Plus Relief.
The small bottle.
Yeah.
The Adrian, the tablets that you just held up.
Yeah, the Plus Motion.
Plus Motion.
Yeah.
Plus Motion, yeah.
5 days. Osteoarthritis in both knees, waiting for knee surgery on both knees, went. No pain.
Fabulous.
Fantastic.
Yeah, the Plus Motion, I'm very proud of the Plus Motion. So I was actually in the team at Rexall that launched Osteo Biflex, which is one of the biggest selling products in the entire world for arthritis. We had licensed the patent from Dr. Theodosakis, who wrote the book, The Arthritis Cure, and we were the first product that had glucosamine and chondroitin in it. And I can't tell you how many people would call me and say, Rick, I've been taking your product for 2 months. It's not helping. I said, well, it took you 60 years to get arthritis. Could you give me 3 to 6 months to see if we can help? You know, I would constantly tell people, give it more time, give it more time. So I'm really proud of the Plus Motion because with the tendaxian that helps with the tendons, with the cetomyristoleate, the long chain fatty acid that actually makes more synovial fluid, more lubrication in the joint. When I'm on stage, I go oil can, like the Tin Man from Wizard of Oz. As it actually helps lubricate the joints right away. And with the Collagen N2, that prevents your body from breaking out of the cartilage while you're making new cartilage. That makes all the difference. So people are getting results in 24, 48, 72 hours. They're getting really much faster results. So I'm really happy because in this industry, when you can make the intangible tangible, that's a game changer. So when people feel the difference, especially when they feel a difference quickly, that can make all the difference. So Paul, I'm really happy we were able to help you.
Yeah, it's all good.
Yeah.
Wonderful. Thanks for sharing.
I am dubious too. I'm dubious too. I never believe anybody.
No, me too.
Apart from me now.
Yeah.
Stephen, you got one last question. You need to unmute.
Yeah.
Thank you very much. Right, Rik, thank you very much for giving us a thorough, basically, explanation regarding thyroid and parathyroid. Would you possibly, I've sent a message over to the lady concerning her thyroid, would you possibly be able to share some information so she could give to her doctor? Because she doesn't want to have her thyroid removed. Yeah, she wants to keep it.
So I would say this, because I had more questions than answers. I need to see what her diagnosis is. So if it's hyperthyroidism, she probably has Graves' disease or Hashimoto's thyroiditis. If she's diagnosed with that, I need to see the blood work to see if it's a proper diagnosis. I mean, do they look at her ANA or SAD rate or CRP? Do they actually identify it as an autoimmune disease, and why? And I say it like that. I don't want to insult her physician, but a lot of doctors, like I said, you walk in and then right away they say you have a sluggish thyroid or you have a swollen thyroid. Let me take it out. Especially if she went to a surgeon first, because all a surgeon wants to do is cut, and there's a reason for surgery, but it's not the first thing you do,
Right. Brilliant. Yeah. Because
can I tell an off-color joke?
Yes.
my wife immediately says no. Okay.
Next one. In person.
Okay. Yeah, my wife says I can't tell the joke, so we'll move on. So yes, Stephen, I'm happy to talk to her, but if you can get me more of her information, I can give better advice. Okay?
Rick, I've got a question for you, Rick. I've got a question for you. We're loving the new packs with the weight loss packs, Trim Science packs. Could I ask the $4.99 Trim Science pack of the meal replacement? We've got one vanilla, one chocolate, and Trim Science in the pack. Is there any chance we can have a $4.99 pack where there's either 2 chocolate or 2 vanilla meal replacements rather than one of each? Because we've got some picky people in the UK that don't like the chocolate but love vanilla.
It's so funny. It's do I have any M&M stuff here? So I don't know if you guys know, I've most of my life I've collected M&M dispensers. So like here's one of my M&M dispensers. It's my M&M guys and like a little plane. So one of the things I learned is that M&Ms are different in the UK than they are in the United States. They actually add butyric acid to it because for some reason in England, you like your chocolate to be a little bitter. You like that bitter flavor, which in America, they want it to be extra sweet. So that's kind of funny that you guys, some people don't like the chocolate. I think our chocolate meal replacement is amazing. I'm very proud of the flavor. But I can understand that, at least in England, you like that butyric acid, the T-butyrate. So that being said, I don't make those decisions, but I'm happy to talk to Michael and Neil and let them know. I think it should be very easy for people to request 2 chocolates or 2 vanillas instead of a chocolate and vanilla. But let me see what he can do.
Oh, that's fantastic, Rick. Thank you. Does anyone else have another question? Because I know Rick's time is very important, and we're coming up to 8 o'clock.
Yes, I do. There was a young lady here. She's left. She asked me about autism and ADHD. What can we take? Is there anything that will help?
Yeah, so we actually did a clinical study with celldefender in autistic kids. We had 67 autistic kids at Arizona State University. Dr. Jim Adams ran the study. And we did that because going back to the late 70s, early 80s, they found out that kids that had chelation therapy, and this was entirely by accident, they had kids that had eaten lead paint. And so they were in chelation therapy to chelate out the lead, and they got function back. They were thinking clearer, they were communicating clearer. So suddenly, for the first time ever, they equated heavy metal toxicity with autism spectral disorder. And so a lot of times they want these kids to go on chelation. The problem with chelation is it can be really harsh. It's IV chelation usually. It's high doses of things like EDTA, which can hurt the kidneys and the bladder. And of course, it's IV. So you're taking a autistic kid and you're making him go through this process. And so they said, instead of chelation, the zeolite is actually a clathrator. It's a little different because it's a static cage that sucks up the toxins. So it's a different mechanism, but it does the same thing. It removes toxins and heavy metals. And so we had already gotten great results with autistic kids. So we did that clinical study and we saw on average about a 9-fold increase in heavy metal excretion. And every one of the kids had better function, better verbal skills, better small small manual skills. And you can see some of this stuff. If you guys go to avinihealthtraining.com, you can see a list of claims, and you'll see autism is one of the things where you'll hear from parents of autistic kids and see the benefits they had as they used the celldefender. We've heard miracles. If anyone's ever seen Carter, Thane Shively's son, I mean, he went from being pretty much completely unresponsive to he just started his own business. He's becoming entrepreneurial. I mean, it has completely changed his life in every possible way. So you can see Carter Shively talk about his own experience using the product and from his what the world looked like before and after he started using the celldefender, which is fascinating to me because none of us can get in the head of an autistic kid, and now he's actually able to say what the world looked like to him before and after. It's fascinating.
Gavin, you've got a question?
Can you?
Sorry, Gavin. Nick hasn't finished. Sorry.
Sorry, Gavin. Carry on. I just lost that train of thought. Carry on. Please carry on.
I'm sorry.
All right. If you think about it, get back.
Gavin?
There's actually a lady had her hand up before me.
Okay. Ranji?
Yes. There's a question in the chat. I'll just read it out. Does this help liver cirrhosis and keloids?
So my first question is, why do they have liver cirrhosis? If they're drinking alcohol, they need to stop drinking alcohol. I love a little bit of alcohol, but too much is going to cause cirrhosis. So the first thing is stop what's causing the problem. But yes, we've actually, I said from the very beginning, one of the things with the celldefenders, people noticed improvement in vision, visual acuity. And we've already seen that people's liver enzymes improved, liver health improved. And so we know that the celldefender, by removing toxic and heavy metals, takes a lot of pressure off the liver, whose job it is to remove toxic and heavy metals through transformation. So we take a lot of pressure off the liver that helps improve liver function and liver structure. But I would also say if someone knows they have a liver problem, they should be taking the Plus Balance, because the Plus Balance specifically has ingredients to improve liver transformation processes and help with liver health. The side effect of that, it sounds weird, you're improving liver health, but the side effect is healthier hair, skin, and nails. So a lot of people take the Plus Balance for hair, skin, and nails, but it's really for liver support.
Okay.
And
the other part of that was, does it help keloids?
Well, keloids really, again, depends on what keloids. Keloids are a lot, sometimes trauma, sometimes genetics. But keloids are usually, most keloids actually can go away on by themselves. If it impinges function, then keloids are removed surgically. I would say as part of a normal course of events, if keloids come and go, this is going to help prevent keloid formation and reduce keloids that have already formed.
Okay. Thank you so much. Yeah. Thanks, Rick.
Gavin, back to you, Gavin.
Okay. This is actually about me. In the autumn of 23, I had a heart attack, and I had a stent put in. and I've been fine. And I had a checkup about 3 months ago, and they said, well, if you want the operation, you can have it. And the reason they're talking about an operation is because apparently I have L2, 3, 4, and 5 discs degenerating in my back. All this has affected my balance and the way I walk, etc., etc. However, I have been diagnosed as diabetic, but I have lost 1.5 stone since Christmas. So I'm just around 14 stone, but I'm 6'1". So what really is disturbing me at the moment is my hands. Now, they said I would get arthritis, and he said that's what the problem was in my back with the degenerating discs, and that was causing arthritis. But in fact, my back, I had some physiotherapy, so on and so forth. And my back really isn't the issue now. What I've had for about a couple of months and is really not helping me function at all is pain in my upper arms and my shoulders, and also my finger on my left hand. My fingers are swollen, and I have permanent pins and needles. I don't know what the technical term, the medical term is for that. And
it's a neuropathy.
Sorry?
A neuropathy.
Right.
Pins and needles.
Yeah. So, and from time to time, I get it in my right hand. And I think I've got carpal tunnel in my right hand, but I live in Spain and I don't speak Spanish. So that's a bit of an issue. I am setting up and coming back to Spain, coming back to the UK to start a new business there. But I was wondering if I really want to get rid of this shoulder, and I read that diabetics might get stiffness of the joints and things like this. I do need to address my diet, I know that, but I'm struggling to exercise properly because of the because of my balance. And so I don't know. I did listen to you, and I heard you say something about a couple of the things that might help. But yeah, my hands I can't really pick anything up with either hand very successfully. I can't even pull a ring pull on a can at the moment. So I'm really just taking tramadol and paracetamol combined for the pain, and they work for about 6 to 8 hours.
Have you tried the Plus Relief yet?
I haven't tried any of your products.
Okay, so there's a lot to unpack here. So let me walk through it. So first of all, for diabetes, you need to control your diet. I said before, our Plus Fiber, you want to take this, just a scoop and about 8 ounces of water. You want to drink it about 10 to 15 minutes before you eat. That's going to lower your blood sugar. It's going to lower your HbA1c. It's going to help control your diabetes. That's the first thing for the diabetes. The second thing is diabetes can cause a neuropathy, but you clearly have arthritis. You have loss of cartilage, vertebral cartilage in your lumbar spine. Understand how your nerves work. All your nerves start in your brain, and your brain is what thinks about everything. It's innervation from the brain. From the brain, you have 12 cranial nerves that come out of the brain and then go all over your body. Okay, coming down your lumbar spine and then out to your trunk is your accessory nerve. So a lot of times you feel pain in your hands, but it's really the damage in the spine that's causing it. That impingement of the nerve you're feeling in your hands. Okay, so it's a lot of problems with the accessory nerve coming down your spine. I don't recommend surgery in the lumbar spine, especially if you can still walk and everything. It can be really dangerous. Fusions are permanent, and they don't really help. Back surgery, for the most part, is some of the most useless surgery you've ever seen. It's really just a Band-Aid. I think you'll be better off with a variety of things. First, the Plus Relief. So Plus Relief, the oral spray and the topical gel. If you can get the topical gel in your lumbar spine, if you have hopefully a loved one that doesn't mind rubbing your back, you should put some of the gel on your spine, but also use it in your hands. It's really easy to use. You need very little of it. We have an 8-ounce pump if you want to use a lot. but just a little bit, rub in your hands. It's naturally anti-inflammatory, analgesic. You haven't tried it yet, so you don't know how amazing it is, but there's no heat, no cold, no numbing, no smell. It's just these proteins from cobra venom that go in and block pain and inflammation. So it's really amazing technology. It is not contraindicated with any other drugs you're taking. So you can take the paracetamol, you can take the tramadol. It's going to make those work better. Eventually, you'll be able to get off of those other drugs. But the Plus Relief first for the pain and inflammation. I would recommend both the oral spray and the topical gel. So the oral spray, you just spray in your mouth like this. You want to take, when you first start, you're going to want to use about 5 sprays 3 to 4 times a day. Just spray it in your mouth. It tastes orangey. The flavor profile we used, if anyone remembers Tang, the breakfast drink Tang, that's the flavor profile I use. It's a nice orange flavor, all natural. So oral spray and topical gel. The topical gel you're going to rub in your hands, and if you can get someone to rub along the lumbar spine where you have the issue in your back, you should try to rub in your back as well. The other thing is for the cartilage. Earlier I talked about the Plus Motion. The Plus Motion is clinically proven to prevent cartilage loss and help rebuild cartilage, connective tissue, and synovial fluid. It's going to help you. It's for your particular problems. It's probably going to take a few weeks to really see a difference, but it's going to help. So that's where I'd really start. And then lastly, even though that wasn't your main complaint, is you had a heart attack and you have cardiovascular issues, you should be on the Plus Cardio Care. So Plus Cardio Care is going to help with cardiovascular function. It's going to help with your heart so you don't have any more heart issues. And it's going to help with surface circulation, so it'll help everything heal a little faster.
Okay. Sorry, can I just check through the list? So there was spray, the gel, the Plus Motion, and what was the other one? There was something.
Plus Cardio Care. Well, the Plus Cardio Care is for cardiovascular health, and the fiber is for the diabetes.
Oh yeah. Well,
I know it's a lot. We're dealing with a lot of lifestyle issues.
What's that fiber called? Sorry.
It's called Plus Fiber Plus Probiotic. It's the new version of our fiber. Plus Fiber Plus Probiotic.
Thank you very much.
Nick, did you remember your question?
If you're going to start with,
I do indeed. Yes. Can you tell me how our vision product helps the eye, and how does it help the optic nerve? Because I'm having some challenges myself, but I have a couple of friends who have how they describe is their optic nerve has turned gray. So I don't know what that means, but
nerve has turned gray. Okay, so that's tricky. When you deal with eye problems, most of our eye problems are just age-related macular degeneration. As we get older, you start to lose those rods and cones. You start to lose flexibility in the cornea and in the lens, and so you wind up with those issues. A lot of that is caused by oxidative stress. Understand that your eyes, the cells in your eyes, are the only cells in your whole body that face the outside world and are alive. They're living. Your skin is dead cells, your hair is dead cells, your nails are dead cells, your eyes are alive. That's why you got to keep them wet, but they also get a lot of damage from oxidative stress. Even the light hitting your eye causes photooxidation, which creates reactive oxygen species, which damages cells and tissues. Which is why you need vitamin A, beta carotene, you need glutathione, which is produced by the liver, to help protect the eye from that oxidative stress. So one of the components in the Plus Mind Vision is lutein. Lutein is a natural extract from marigolds, and it blocks blue light, bends that blue light, and protects the eye from that oxidative damage. It's clinically proven to not only prevent that damage, but heal that damage over time. We use a very high dose. We use 10 milligrams of lutein. So if you look clinically, the lowest dose of lutein is 3 milligrams. A lot of products have 3 milligrams or less. But at 10 milligrams, we're actually not only protecting the eye, we're rebuilding the eye from damage from oxidative stress. We also put bilberry extract in here. Bilberry is another really strong antioxidant. It's got proanthocyanidins in it. And oligomeric proanthocyanidins, which help protect the eye from all sorts of free radical damage. So that's the primary thing for the eye. The other thing is because the eye is attached to the brain, it has neurotransmitters, DMA, dimethylaminoethanol, which is a direct precursor to acetylcholine. We also added huperzine in it. Huperzine blocks the activity of acetylcholinesterase, which breaks down acetylcholine. So you wind up with more neurotransmitters that last longer. While that helps with cognitive function, it also helps the eye because the eye is sending signals to the brain. So you're getting better signaling from the eye to the brain. So it's improving visual acuity that way. Now, if they have actual problems with the optic nerve, that's usually an indication of a disease. It could be retinitis pigmentosa. It could be multiple sclerosis. A lot of MS patients get something called optic neuritis, which is inflammation of the optic nerve. So if they have those sort of issues, they should be looking for an underlying cause. So make sure they're doing an MRI of the brain, get a good diagnosis, and then we could address that as well.
All right. Okay. Lovely.
Knowledge is power. Don't be afraid to go to the doctor and at least
Absolutely.
get a diagnosis.
Yes.
Right, we've got one last question from Stephen.
Yeah. What it was is, are all of the Avini supplements contraindicative to other medications?
No, the fact is, I'm going to say for the most part, none of our products have any problems with any medications. The big issue is the fact that as you get healthier, you might not need your medications. And I'll give you an example. We have one of our employees, Sean McManus, is on a bunch of blood pressure medicine. He's been losing weight, taking our products, getting healthier. And the other day he passed out and actually hit his head on the counter because his blood pressure got too low. Okay. So he went to the doctor. The doctor says, you got to get off all those supplements. Your blood pressure is too low. No, you're healthier. You need to get off the blood pressure medications. You know, the blood pressure medications are artificially driving down his blood pressure when his body was just doing fine. Okay. So I warn people, if you're on medications while you're using these products, make sure you monitor your health conditions because there is a really good chance that you could reduce or even eliminate some of your medications as you get healthier and as your body self-corrects. Okay.
Brilliant. Thank you.
My pleasure.
Mr. Rik, you have again done a wonderful job. Thank you so much for your time, Rik. I mean, we've really enjoyed it. Lots of fantastic advice from you as normal. Rik, thank you so much indeed for coming on and giving us, hour and 15 minutes of your time. We really appreciate it. And there's lots of us who are going to be coming out to Florida in October, by the way.
Yes. Yeah.
Oh, yeah?
Yeah.
Okay.
Yeah,
The Orlando conference.
Yeah.
Yes.
Yeah, I'm coming.
Now, I got to tell you, the thing in Boca in May is actually here at my facility, our 33,000 square foot facility. So we're giving tours. I don't know what we're going to do for Orlando. I'd love it if you guys coming in, because Orlando's only about 3 hours north of Boca Raton. So if someone actually wanted to stay and then come south, I'd love to try to arrange where people either before or after probably after would be easier, after the conference, came down to South Florida and then you could see the facility.
Yeah.
So I'll talk to Neil about that. He'll probably yell at me for even mentioning it. But it is really easy to get from Orlando to here. There's even a train called the Bright Line, which can do it in about 2 hours. So you take the train from Orlando down to South Florida. And we actually are right out from the train stop. You go walk from the train stop to the office. So let's see if people are coming out to Orlando, you might want to spend another couple of days and come down to South Florida.
Yeah.
Susie and I are definitely going to do that because we're going to see you too.
Well, you're personal. I'm going to bring you to the house, and you can. I'll treat you to my place because I live in Parkland. So we're right by the beach. So Florida is kind of weird if you don't know South Florida. Most of Florida is swamp. All the middle of Florida is swampland, is the Everglades. So there's this narrow band about 10 miles between the beach and the swamp where everybody lives. So we're in our offices are really close to the beach. I live by the swamp. The Everglades are my backyard. I've got alligators and turtles in my backyard. So if you really you want to be adventurous, come over to my place. You can
Wonderful.
see some alligator.
Yeah, he's looking forward to that. Thank you so much, Rik. We really appreciate your time. I hope everyone enjoyed the call.
That's
Thank
great.
you very much. Yeah, it's great.
Yeah.
Thank you.
Good night, everyone.
Thanks, everybody.
Thank you very much.
Thank you. Thanks so much.
Bye.
Bye-bye.